Good day, teachers, staff, learners of Bayang National High School. I am Maria Jubel Lorraine P. Bolivar, a registered guidance counselor. Today's webinar, I will be discussing and sharing to all of you mental health awareness, blended hugs, helping others through psychological first aid. So, before we begin our webinar, these are the friendly reminders of all. These are the objectives. At the end of the webinar, the participants are able to understand the different concepts in the provision of mental health and psychosocial support, differentiate the possible strategies in the provision of mental health and psychosocial support, and appreciate the importance and limitation of the psychological first aid. Okay, so before we begin, let me ask you, teachers, staff, and learners, how do you feel today? Are you happy, or do you feel confused, or nervous, anxious in this time of pandemic? How do you feel? So, list down the emotions or the behavior you have experienced during this COVID-19 pandemic and to the new normal situation in our school setting. You feel irritable, impatient, or do you feel nervous, angry, or you feel depressed? Physical illness you have, or there's a nightmare or procrastination, or do you feel sadness or hopelessness? Do you feel overwhelmed, forgetfulness, or do you feel you have a trouble sleeping? Do you feel negative thoughts in your everyday life, or do you have avoidance to the situation today, withdrawal, poor performance in school, or are you performing well as a teacher and as learners? Or do you feel anxious of this kind of setting that we have in the school? Did you know that high level of stress can be negatively affect our mental health and physical health as a teacher and also as a learner? So another problem that our government is facing today is that to flatten the curve, that is why we need to follow the safety protocols in order this COVID-19 virus to stop from spreading. At the same time, we are experiencing our government facing another challenge, and that challenge is our mental health. The using of mental health over the world is very popular. That is why that did you know that too much of stress can affect our mental health and can be deadly. So there is a mental health RA 11036, otherwise known as mental health. Mental health refers to a state of well-being in which the individual realizes one's own abilities and potentials. It copes adequately with the normal stresses of life. So, kaya natin lagpasin and solve the problem and our decision making. So, when we say mental health, sometimes we have a stigma that mental health is always may problema lang sa pag-isip, or what is that? It is we should alisin natin yung stigma that if we have a mental health concern ay nababalir o buang. So hindi ng lahat ng tao na may mental health concern ay kailangan ng treatment. sometimes iba ay kailangan ng PFA or psychological first aid. So, which we will be discussed later. There is a mental health services. So it refers to psychological, psychiatric, or neurological activities and programs along the whole range of mental health support. So there's a mental health level. So if it is lower it will be psychosocial. So if it's there's an illness, you will go to psychiatric and a neurological, like psychiatrist, psychologist, and also registered guidance counselor. Mental health professionals refers to a medical doctor, psychologist, nurse, social worker, registered guidance counselor, or any appropriately trained and qualified person with specific skills relevant to provision of mental health. So I highlighted it, appropriately trained and qualified person. So like for us teacher, we also need training like INSET and other trainings that will upgrade our knowledge. So what are the role of our school is to promote mental health. A role of educational institutions. All public and private educational institutions shall be required to have a complement of mental health professionals. Employers shall develop appropriate policies and programs on mental health in the workplace designed to raise awareness of mental health issues and correct the stigma and discrimination associated with mental health conditions, identify and provide support for individuals at risk, and facilitate access of individuals with mental health conditions to treatment and psychosocial support. So, what is psychosocial supports? So, as you can see this, if we give psychosocial support, we also need to consider this. So meaning, if we give the psychosocial support, we need to know the national laws and policies. You cannot give counseling if you are not registered guidance counselor, and we need also to consider the multicultural practice. We need to know and be aware if we have students that are foreigners or living in other regions in the Philippines. So at the same time, we anchor this to the guidelines of Department of Education in giving psychosocial support. So we cannot go beyond to this. So normal adaptations and coping responses. So seeking help from others or offering help to others. Talking about their experiences and trying to make sense of what we happened. Also, trying to stay safe until the danger has passed, and seeking about the welfare of their loved ones. They may fight to survive or flight or freeze, but go on to adopt. So, psychosocial support is essential for maintaining good physical and mental health, and provides an important coping mechanisms for people during difficult times. So, psychosocial intervention constitute the backbone of any mental health psychosocial support response and include a range of social activities designed to foster psychological improvement, such as sharing experiences, fostering social support, awareness raising, and psychoeducation. So, psychological first aid or PFA. So, what is it? It describes a humane, supportive, responsive to a fellow human being who is suffering and who may need support. So it aims to provide psychological, social support, reflecting aims similar to those of physical first aid, to assist people in the emergency disaster situation to survive, to minimize psychological injury, and to facilitate recovery. So, psychological first aid. It is a method of helping people in distress so they can feel calm and support to cope better with their challenges. It is a way of assisting someone to manage their situation and make informed decisions. The basis of psychological first aid is caring about the person in distress and showing them empathy. So it involves paying attention to the reaction, active listening, and if we needed, practical assistance such as problem solving, helping to assess basic needs, or referring to further options for assistance. Psychological first aid, it also helps normalize worry and other emotions, and also promotes healthy coping and provide feelings of safety, calming, and hope. So it involves the following themes. It providing practical care and support, which does not include assessing needs and concerns, helping people to address basic needs, for example, food and water, and such as information, listening to people, to our colleagues, to our learners, but not pressuring them to talk, comforting our colleagues or the learners and helping them to feel calm, helping them to connect informations, services, and support, also protecting them from further harm. So, what is psychological first aid? Is not. It is not something that only professionals can do. So, also, PFA providers are trained for that training. There's a training for that. So, it is not professional counseling. This is not a counseling. So, you cannot give the counseling if you are not a registered guidance counselor. It is not also a psychological debriefing. In that PFA, it does not necessarily involve a detailed discussion of the event that caused the distress. It is not asking someone to analyze what happened to them or to put time and event in order. Although PFA or psychological first aid involves being available to listen to people's stories. It is not about pressuring people to tell you their feelings and the event in their life. So these are the core action principles. So look, listen, and link. So let's proceed to look. It refers to assess, check for safety of the colleagues of us or our learners, find those priority needs of serious distress. You need to know that the current situation of that person who seeks support, what the needs of the effective, expected emotional reactions. So, the stress reaction to crisis. These are the physical symptoms. They feel shaky or headaches, fatigue, loss of appetite, aches and pains. It also feeling anxiety or fear, weeping, grief or sadness, guilt, survive, or for not saving others, elation for having survived, being on guard, jumpy, anger, and irritability. So, distress reaction to crisis, being immobile or withdrawn, disorientation, not knowing one's name, where one is from, or what happened, inability to speak or to respond to others, confusion, emotionally numbness, being in a daze or state of disbelief, inability to care for one's children, not eating or drinking, or able to make simple decisions. So, looking remotely, these are some considerations. The social media post, you need to know. I mean, sometimes the person are posting it in Facebook. You need to know it. So nowadays, learners or a lot of students and learners of us are posting social medias or anger, happiness, or other things in the social media post. Social exclusion or no longer response to correspondence such as emails, calls, messages. Um, you should look about them. I mean, you should look to our students and our colleagues. Low work productivity, or our colleagues are poor work output, does not submit on time, does not attend meetings, and so many things that they are doing, but they are not going to school, or something that something is wrong that make that person poor in their schoolwork output. So these are the second, the listen. It refers to how to those who need support to their concern. Help them to feel calm. Listen with eyes full of attention. Ears truly hearing the worries of those affected, and the heart with genuineness and respect. So it refers to how to begin the conversation, introduce the helper, pay attention and listen actively, accept the feelings, calming someone in distress, ask about needs and concerns, help find solution to needs and problems. So active listening, a way of listening and responding to another person that improves mutual understanding. A structured form of listening and responding that focus the attention of on the speaker. Things to say and do. Try to find a quiet place to talk to your colleagues or to your learners, and minimize outside distractions, and stay near the person. But today, because of the pandemic, we cannot do this. But maybe in the next few years, we can do this. But for now, it is best to be safe than sorry. So, stay near the person, but keep an appropriate distance depending on their age, gender, and culture. Let them know you hear them. For example, you nod your head and say, be patient and calm. Provide factual information if you have it. So what do you know? What you don't know? I do know, but I will try to find about that for you. That's for example. So you should not say that, I know that or what. But of course, you will be honest to that person. So things to say and do. Give information in a way that the person can understand, and keep it simple. Keep it just simple. Acknowledge how they are feeling and any losses or important events that they share with you, such as loss of home or death of a loved one due to COVID. So, or other things that they are sudden death of the immediate family or something. So you will say, I'm so sorry. So respect privacy. Keep the person's story confidential, and especially when the disclose very private events. So this is very confidential. You should not divulge the things that the person say to you, because that is very important. So acknowledge the person's strength and how they have helped themselves. So things not to say and do. Don't pressure someone to tell their story. So if they don't like it, you should not pressure them. Don't interrupt or rush someone's story. You should not say that, oh, what's your story? Go, go, go. No, you should step by step if that person share their story or not. So don't give your opinions of the person's situation, just listen. You don't give opinion of your opinion. Don't ever touch the person if you're not sure it is appropriate to do so. So in that case, for me, don't ever touch that person. Don't judge what they have or haven't done of how they are feeling. Don't say, you shouldn't feel that way. You should feel lucky you survived. No, we have different feelings. We have different stories in life. So we have to mind the feeling of that person. Don't make up things you don't know. Don't use too technical terms. Of course, some of our learners don't know about it. Don't tell someone else's story. That's the very confidential one. Don't ever tell, even that's in your family member, don't ever tell someone's story to them. Don't talk about your own troubles. So it's not appropriate to talk about your troubles in front of that person. Don't give false promises or false reassurances. Don't feel you have to try to solve all the person's problems for them. Also, don't take away the person's strengths and sense to be able to care for themselves. So these are the considerations for remote psychological first aid. So empathy and warmth, these are really very important. Attention and affirmation, in acceptance, and also safety of you and the person. Asking the right questions. Be aware that it's normal to react with anger, frustration, or confusion when experiencing adversity. So, remote PFA, first, you need to introduce yourself. Also, ask how can be of help to that person. Agree on the duration of the call. So, for for us in this pandemic new normal situation, we are using video call, voice call, and other platforms such as Google Meet, Zoom, Facebook Messengers. So this is a kind of very important. So listen to the practical and emotional needs of the caller. Ask about coping, self-care, and stress management. Ask what the caller will choose to do, and the caller to find out things that they can do or suggest they write a list of inspiration. So these are the last. Link. It refers to how to assist with people to basic needs and services, to information to their loved ones, to further support, assessing information, connecting with loved ones and social support, tackling practical problems, assessing services, and other help. So these are the considerations. It refers to specialized help if a caller has not been able to sleep for the last few weeks and is confused and disoriented.
So it is to distressed that they are unable to function normally and care for themselves or their children by for example not eating or keeping clean, loses control over their behavior and behaves in unpredictable or destructive manner, so threatens harm to themselves or others. So it also starts excessive and out of ordinary use of drugs or alcohol, are living with psychological disorder, and or were taking medication prior to the situation to distress may also need to continue mental health support, present chronic health conditions and need more support, present symptoms or severe mental health conditions. It is experiences violence or is being sexually abused in any way. So, link. It refer as if there are any practical problems or challenges. Refer to other services if needed. So, if there is, there's none. And the conversation is so summarize the conversation by highlighting key issues discussed and action points identified. Agree on a follow-up if possible and end the call by thanking for the conversation. So, professional behavior in delivering a psychological first aid. So first, operate only with the framework of an authorized disaster response system. Model healthy response such calm, courteous, organized, helpful. Be visible and available, maintain confidentiality, and remain with the scope of your expertise and designated role. Make appropriate referrals if you don't know. There's a lot of referrals in guidance, school guidance counselor, registered psychologist, psychometrician. Be knowledgeable and sensitive, cultural, culture and diverse. Pay attention to your own emotional and physical. Practice self-care. That's the very important of it. So don'ts in delivering psychological first aid. Don't make assumptions about what the survivors are experiencing or what they have gone through. Do not assume that everyone exposed to a disaster will be traumatized. Do not pathologize. Do not label reaction as symptoms. Do not talk down to or patronize the survivor or his helplessness or weaknesses, mistake, disabilities, and what he needs has done effectively to help others. Do not assume that all survivors want to talk or need to talk to you. Being physically present in a supportive, calm way help survivors feel safer and more able to cope. Do not debrief by asking details of what happened to them. Do not speculate or offer a possible inaccurate information. Know the facts before answering their questions first. So our reaction to COVID-19 pandemic are normal reaction to abnormal situation. So that will be all. I hope I was able to share with all of you the this. I hope uh, I hope you all learn and apply this during this time of pandemic or normal, new normal situation and also in our daily life. So I would like to thank Bayang National High School for having me here as a resource speaker, and also I would like to thank you PGCA
Philippine Guidance and Counseling Association for for giving me information about this topic. These are my references in today's topic. So I hope all of this information that I give will be useful to all of us, teachers, staff, and our learners. So thank you very much and stay safe. Bye.